Hi, my name is Michelle Sombrano, and I'm the project coordinator with the State Opioid Response Grant at Southwest Behavioral Health. I'm here today with Chris Abert, who's the executive director over at Southwest Recovery Alliance, and we are discussing harm reduction. Hi, Chris, how are you doing today?
I'm good. How are you? Thanks for having me.
Good. Yes,
Good.
thanks for joining us. So, just really quickly, what should people know first and foremost about harm reduction?
I think people already know about harm reduction. We practice it every day. Um, I think the most general idea is that the world is often harmful and we can do things to protect ourselves from that harm. So people that wear seatbelts today, people that have used designated drivers, using sports equipment, all those things are harm reduction. I think what's interesting about my branch of harm reduction, what I'm engaged in my life, as far as people who use drugs, is that it was started by the people who were using drugs. They didn't have access to medical services. They didn't have access to the supplies that they needed. And so they went out and got those supplies and started giving them out in the spirit of mutual aid. After they started doing that, then it was proven that it was mitigating HIV and hepatitis C, that people could use naloxone to reverse overdoses in their own homes,
Mhm.
has reversed the opioid death toll that we're currently going through, um, has enabled connection for the people who were using drugs despite the fact that they were still using, and really created a place where people could celebrate small positive changes. So it wasn't just you have to abstain, it was and then you can celebrate. It was like, I've done this small thing to better my life and to better the community, and let's celebrate that. So in a nutshell, I would say that harm reduction is any positive change and celebrating
Nice.
that positive change.
Nice. So, what are some of the core values of harm reduction then?
So, harm reduction is kind of a buzzword these days, and there are some things that people can look for in programs that are purporting to have a foundation of harm reduction. I think that whatever the program is looking for as a success kind of tells if they're doing harm reduction or not. So if we focus on the health and dignity of people, uh, oftentimes instead of abstinence only, um, the outcomes can be better and more compassionate. So that's definitely one of the core values. Making sure that the services are participant centered, that people had a real voice in creating those programs, right? That they said, yeah, these are our needs. And then people collaborated with them to have those needs met. Um, I think making sure that people understand how important participant autonomy is. The National Social Worker Code of Ethics talks about respecting autonomy. And we want to just recognize that people are the experts in their own lives, and they deserve to be treated like adults. Recognizing that it's like pragmatism and realism in drug use, that we're never going to totally get rid of drugs, that as far back as we can look, people have been using drugs. So accepting, for better or worse, that drug use is a reality, and taking steps to protect people from harm given that reality.
Great. So, we have advocacy, person centered, compassion, but not abstinence, but just a betterment of overall health. Those all sound like they feed into the social justice elements of harm reduction. Do you want to talk about the connection between those two aspects?
Yeah, I mean, that's actually another core value of harm reduction, or the taking into account the sociocultural factors, the social determinants, the history of racialized drug policy, and the immense amount of harm that has done, not only in the United States, but across the world.
Hmm.
So harm reduction, there's a quote that by Lilla Watson. It is, if you have come because your liberation is bound up in mine, then let us work together. And I think that is key. So people who have suffered from racialized drug policies, which are clearly outlined throughout history for the last 150 years, those folks have a lot in common oftentimes in the intersection, be it racism or gender identity or sexuality or history of incarceration, or adverse childhood experiences. All of those are caught up in our social structure, and we have to look at the structures that propagate some of these harms. And oftentimes, as I said, this is legislative with this racialized drug policy, but also built into the nonprofit system as well, in an oftentimes paternal relationship rather than collaborative relationship with people.
So, I mean, those sound like really big aspects to tackle within social justice and harm reduction. But what is something that somebody can implement in their life right now to start practicing some of the core values of harm reduction?
I feel like wearing masks right now is a really good example of harm reduction. Right? So of course it would be better to stay home and don't go within 6 feet of anybody. But you know, one of the medical masks would be better than just a bandana. Just the fact of putting a mask on reduces my opportunity to spread the virus to someone else. And if they in turn have a mask on, then we're doing this reduction of likelihood of transmission. So it's not perfect, and we would never yell at someone and be like, how dare you go to the grocery store and put people's lives at risk, right? You go to the grocery store. There's going to be things that we engage in our life, and we can mitigate harm to ourselves and to others through the use of those masks. In general, towards people who use drugs or people who are experiencing homelessness or poverty, I think that a way we can practice harm reduction is just listen, right? Again, they are the experts in their own lives. They have so much to tell us. Not only if we're actually listening and building rapport and meeting people where they are, not only can we learn how we can help them in terms of health and maybe legal issues and financial issues, but we can actually connect with people and make sure that they know that they're human, that they're worthy of help, that they have a right to some dignity and respect in the services they engage in, and that the contents of someone's urine screen shouldn't trump the character of their behavior.
The value of that person. Correct. Great. Thank you so much for joining us today, Chris. Again, this is Executive Director Chris Aber with Southwest Recovery Alliance. Can find you on Facebook, correct?
Yep.
Your group, and you do tons of work out in the community. If anybody's interested in joining that, please look into it. They're a great group. I volunteered with them at least once before all of this hit, and look forward to rejoining those efforts with you when all of this passes. Great. Thank you so much for being here today.
Thanks. Bye-bye.